It's amazing that it was 3 decades ago that since the first few cases of an unknown syndrome affecting gay men was described by the CDC in Los Angeles and then subsequently in New York. And I think since that time we've seen tremendous advances, both in treatment of HIV. Specifically, now we have more than 27 highly effective antiretroviral therapies to manage this condition. We've seen tremendous advances in the way we understand how this disease is transmitted, among whom, as well as how to target our efforts. We've had tremendous advances with prevention as well. The sad reality today is that nearly 70% of HIV infections diagnosed in young people are among the African American community. So they're African American youth which bear the brunt of the epidemic among young people. That is an area of concern for us at CDC, and we've been doing quite a bit of research to understand why black youth are so affected by this disease. I think there are some general factors, the invincibility of youth, the fact that young people are more likely to have higher risks, sexual behaviors, new partners, etc. We know that STDs, for example, gonorrhea and chlamydia, are higher in young people, and we see much higher rates among African American youth. But there's also one other factor which I think could explain why we're seeing this disproportionate burden of disease among African American young people. And that is what we call the force of infection in the African American community. Now think of it this way. If we have higher prevalence of HIV within a given community, and you're likely to have your own sexual partners from that community, it means that your probability of coming in contact with HIV is much higher than others. And we see this for African American youth because the background prevalence or level of HIV in the African American community is much higher than it is for white or Hispanics. And it means that for an African American young person who's having sex for the first time or who's having sex with partners who are slightly older, they're much more likely to come into contact with HIV. And that feedback loop is what is driving and contributing to the high rates of HIV among African American youth. So there are multiple factors, and I wouldn't want to say there's one greater than another, but it's a very unique circumstance that we're dealing with today. For heterosexual women, you know that the burden of HIV/AIDS is tremendous compared with, among heterosexual black women, is tremendous compared with heterosexual white women or Hispanic and Latino women. And the figures are really staggering. Black women have HIV infection rates which are 15 times higher than those among white women. And HIV/AIDS is the leading cause of death among African American women aged 25 to 34 years. So we're looking at a real burden of this disease, especially among young African American women. CDC has done work looking at the source of HIV infections among male partners of women. And we have found that the majority of these infections are not coming from men who are behaviorally bisexual. In other words, men who are on the down low or having sex with other male partners. But these are men that are having multiple sexual partners with women and therefore placing their female partner at risk of acquiring HIV. Their male partners may also be injecting drugs or may be using drugs, which also puts them at higher risk of acquiring HIV. We are dealing with a disease which is entirely preventable. And what we are seeing now, this crisis, does not have to be the reality. Everyone and every action counts. And if we are going to be truly successful in bringing this epidemic to an end, we are going to have to enlist hearts and minds of the nation, of communities, and of individuals across the country in bringing this disease to an end. All of us have a role to play in ending this epidemic, whether in reducing risk behaviors, talking about HIV to our family and friends and those who we love, getting HIV tested, knowing our HIV status and encouraging others to know their status, mobilizing our political leaders, our community leaders, and our faith leaders around this epidemic, and tackling stigma and discrimination and the silence which continues to kill so many members of our community every day. These are strategies that we can all employ, and we must employ if we are going to get ahead of this curve.